Well, I'm Dr. Carmen Puliafito, and I'm happy to have with us today Dr. Diana Doe, who's professor of ophthalmology and vice chair of clinical affairs at the Department of Ophthalmology, Byers Eye Institute at Stanford University in Palo Alto.
It's
Dr.
great to
Doe,
talk to
welcome.
you. Yes, thanks for inviting me, Carmen.
Welcome to Retina Synthesis. Today, we'd like to talk about your presentation at the Angiogenesis 2021 virtual meeting about KS-301, the Kodiak long range, long durability anti-VEGF agent. Can you tell us a little bit about the molecule, because it's a unique, has a unique formulation?
Yes, I think this is very exciting clinical development. KS-301 is a novel intravitreal anti-VEGF agent that's built on an antibody biopolymer conjugate ABC platform. And this platform is precision engineered to deliver extended durability, efficacy, and fast systemic clearance. How does it do it? Well, the ABC platform allows for a high molar dose concentration of the drug to be delivered into the eye. It's optically clear. The antibody is stably linked to this phosphorylcholine biopolymer, and together it allows for extended durability of action to inhibit VEGF. And the good news is we've seen in clinical practice through this large phase 1B trial that included over 121 treatment-naive patients with either wet AMD, diabetic macular edema, or retinal vein occlusion. We saw from the 1-year data that 2 in every 3 patients that were treated with KS-301 were able to have a 6-month or greater treatment-free interval after receiving only 3 loading doses. This is really compelling data.
How was the study designed?
This was a randomized clinical trial evaluating 2 different doses of KS-301 in these treatment-naive eyes. Patients were given 3 loading doses and then evaluated monthly. Pre-treatment criteria were specified that allowed for retreatment for either wet AMD, DME, or RVO, and investigators could also treat at any time point in the study if they thought disease activity was present. So I thought it really gave a good study design to test the durability of this new agent.
So, and what were the findings?
The findings were very
in terms of durability.
Yes, the findings were very promising. And I think the objective of this study, of course, was looking at safety, durability, and efficacy. And we saw in this large treatment-naive patient population that over 66% of patients could have a 6-month or longer treatment-free interval after receiving only 3 loading doses. And this was important because this study is still ongoing, but this 1-year data shows that there is a strong durability signal with this agent. And right now, the pivotal clinical trials in wet AMD, diabetic macular edema, and retinal vein occlusion are ongoing. So we'll be able to know within a couple of years whether or not this new agent, KS-301, can be a game changer.
Was the durability the same in RVO and DME as it was in neovascular AMD?
Actually, the durability was even stronger in diabetic macular edema. If we recall, in the study design, actually there was capped mandated retreatment in the wet AMD patients every 6 months.
Correct.
So even if there was no disease activity, there was a mandated retreatment.
Mm-hmm.
However, for diabetic macular edema and retinal vein occlusion, there was no capped or mandated retreatment. And we can see that in the diabetic macular edema eyes, actually there was only an average of 1 injection in the durability assessment phase of the study, which spanned 10 months. So it shows that this agent has the potential for long-lasting clinical durability.
How were the visual acuity and OCT results?
Yes. I think the visual acuity data and the OCT data are also very encouraging. We saw that in all of these disease states, in these treatment naive eyes with wet AMD, patients gained vision over the 1 year period. They gained almost 6 letters of vision and also had significant reductions in their retinal thickening. In diabetic macular edema eyes, they gained on average 7.6 letters with only an average of 4 injections over the entire year period. And in retinal vein occlusion, those eyes gained on average over 22 letters with a mean of only 4.7 injections over a 1 year period. I think these data are promising.
How did how was the study designed for the phase 3? What in terms of loading doses and frequency?
Yes, I think the phase 3 trial design, specifically the DAZZLE study for wet AMD, has learned a lot from this large phase 1b data. And for the phase 3 trial, they are continuing with 3 monthly loading doses and then following the patients monthly, but then allowing them to be treated at different intervals, going as often as every 12 or 16 weeks or longer between treatment doses if disease activity criteria are not met. In addition, I think they're also using a little bit tighter OCT criteria of 50 microns for disease activity, which should allow for even tighter disease control.
Well, thank you so much for this discussion. We're really excited about KSI 301 and more news in the future.
Yes, I think it'll be exciting, one to watch.
Thank you.
Thanks, Carmen.